Good evening, everyone. Thank you for taking the time to join us this afternoon. I'm Andrea Barton-Rees. I'm the CEO of the Paid Leave Authority, and I'm really happy to welcome you to this presentation we're giving that is more worker-focused around how paid leave will work. So the presentation it's a little long. It is about 30 to 35 minutes. I'll try to move through it quickly, but not so quickly that we don't have an opportunity to really take in the information. And then afterward, I will answer as many questions as we can and make sure that we end on time because I know that it's late in the evening. So I will get started. And as Amber mentioned, please do use the Q&A feature. And just like that, the presentation disappeared. Just give me just 1 second. I just had it. Okay, let's try this again. All right, here we go. Came right back. And so Amber, if you could just confirm for me.
We can see your screen, Andrea.
Thank you. Let me turn off my video so you don't have to look at me the whole time. Meeting controls, and we'll start from the beginning. And we'll get started. Great. All right, just a little bit about me. I was appointed on January 23rd and started on March 2nd of 2020. I've worked for Chubb Insurance, and I last had a role as the CEO at HARC that supports people with intellectual disabilities. Let's talk a bit about the paid leave program. We are going to make a distinction between what is family and medical leave and what is Connecticut paid leave. They are related, but they are different. And we'll talk about how to implement the paid leave act from the employee perspective and family and medical leave. We'll show you where you can find additional resources and then answer any questions that you might have. So let's talk about the Paid Leave Authority. The Connecticut Paid Leave Authority is responsible for 5 primary things. It is our job to pay out the benefits, and it's also our job to do a few things. We are responsible for outreach and engagement, so we are holding 29 scheduled webinars. By the time we're done by the end of November, we'll probably have held close to 60. We will have policies and procedures that are needed to run the program. We establish those. We also establish the trust fund that is responsible for taking in the 0.5% that people have been contributing to the fund. Some employers have chosen to offer their own plan, and that is known as a private plan, and we approve that process and we also audit them. And finally, we administer the benefits as they're going to be paid out starting in January. Here are some key dates that you might be interested in. Starting last November, employers were supposed to register with us, so we knew that they were aware of their obligation to withhold the 0.5%. Employers were supposed to begin deducting the 0.5% from worker wages starting in January of this year and submitting those to us at the end of every quarter. If an employer was offering a private plan, we opened up the application for that in February. Starting in December, on December 1st, you will be able to submit an application for paid leave benefits. And if your application is approved, then benefits will begin to be payable effective January 1. But I'll go into that later, but you don't get a check on that particular day. It's just that's the day that you're eligible for your benefits to begin. A bit about who is covered by the paid leave law. Covered workers include all those who work for employers that have 1 or more employees in the state. That includes nonprofits and those private sector employers that have a unionized workforce. If a person is a sole proprietor or a self-employed individual, they can opt in, but if they do, they have to stay in for 3 years. If a sole proprietor has employees, the sole proprietor can opt in, the employees must participate by law. Some of the employee groups that are not covered are those who work for the federal government, and some who work for the state of Connecticut, except for those covered public employees. Those that work in municipalities are also not covered, or local or regional boards of education, unless they too have what are known as covered public employees, and I'll go over that in a moment. The only class of worker in the state that is completely excluded are those that work for non-public elementary or secondary schools. There are a few other groups of people who work for employers that are exempted. Railroad workers, people who work for governments for other states. We have a lot of folks that work for state universities other than UConn who live in Connecticut, people who are employees of sovereign nations. We've got folks that work for Iran and England and just all countries all around the world that are here, that work in the embassies, people who are working in interstate commerce, and folks who are spouses of active military who are paying their taxes in their home state instead of where they're deployed. Those groups of workers are also not covered under the law. A covered public employee, which I referred to earlier, fits into four categories. They are a non-unionized employee of the state of Connecticut, so all the managers that are not unionized, the unionized employees, if they collectively bargain to be included, those that work for municipalities and local or regional boards of education. So if you work for a municipality, state, a town, a village, so on, and you're in a union and you vote to participate in paid leave, then everyone who works there, whether they're in the union or not, participates in the program. And the same is true if you work for a local or regional board of education. If the union votes to be included, everyone in the workplace is included. So what happens to the 0.5% that's being collected? It's being collected by an employer, and the employer is responsible for remitting those contributions to the Paid Leave Authority. We do validate those based on information that we get from the Department of Labor and the Department of Revenue Services. They are deposited into the Paid Leave Trust Fund, which is managed by the Office of the Treasurer. We do not hold that money at the Paid Leave Authority. It is managed by the Office of the Treasurer that manages essentially all of the money for the state and for agencies like ours. And then it's from that trust fund that benefits are paid. They are post-tax benefits based on the wages calculated for FICA, and they are capped at the Social Security contribution limit of $142,800. Now, let's go through a bit about what is family and medical leave and what is Connecticut paid leave. Family and medical leave, which some of you may not have heard of, because if your employer had 75 or fewer people or 50 or fewer, this would not have applied to you. So it stands for the Family and Medical Leave Act. There is both a federal and a state version of this law. What it allows you to do is to take time away as an eligible employee so that you can take care of yourself or your family, but your job is protected while you are away for a certain number of weeks until you return. We've had FMLA in the state of Connecticut since 1996. That leave is unpaid, and it has been, and that will be the case until January of next year. And some employers, however, do have a policy where they continue to pay people while they were out, although by law it is unpaid, or many require their employees to use their accrued time, sick, vacation, and the like. All of this will change in Connecticut starting next year. So CTPL is Connecticut Paid Leave, and we use it to refer to the statute, the program, and the agency that runs the program. It is only a Connecticut law, and it does provide a source of income replacement for those eligible employees who are unable to work because of certain family and medical reasons. It does not offer job protection, meaning that you can come to the Paid Leave Authority after having discussion with your employer and get benefits, but if you haven't been working for your employer for a certain amount of time, then your job isn't protected when you go. And I'll get more specific about what that is in a moment and what those timeframes are. It's also known as PFML, or Paid Family and Medical Leave. Here are the reasons why you would take leave, and also the same reasons you could seek income replacement from the Paid Leave Authority. You can get leave to receive treatment or recover from your own serious health condition, which can include pregnancy or serving as an organ or bone marrow donor. Excuse me. You can care for a family member who's had a serious health condition. You can also take leave for bonding for a newborn or a child that is new to your family through birth, adoption, or foster care. If you've had a family member injured during active duty, that's known as military caregiver leave, and there's up to 26 weeks of leave available, with 12 of those weeks paid. And there's also qualifying exigency leave, for which paid leave is also available. What is unique to Connecticut is that up to 12 days of leave can be taken to address issues that are directly related to family violence, also known as domestic violence, which is only available, we know right now, in this state and not under federal law. Caregiver leave will be expanding significantly starting next year. If you were to take family and medical leave right now, you can only take it for yourself, to care for a parent or a spouse or a son or a daughter who's under the age of 18. If they were over 18, then they would have to have a disability. Starting next year, that the definition of family will expand significantly to include all of the categories that are on the screen here. So you will be able to care for not just the parent or the spouse. The son or daughter can then be of any age. You can now take care of your siblings, grandparents, grandchildren, or anyone with whom you have these types of relationships, but you may not be related to them by blood, and that is or marriage, and that is known as relationship by affinity. And that is any person with whom you have a significant personal bond that's like family, regardless of whether you have a biological or legal relationship to them. Often we refer to this as relationships like unmarried significant others. They may have lived together for a significant period of time, own property together, be the beneficiaries on one another's life insurance policies, raise children together, but have not married. So even if they don't have a legal relationship, with the appropriate forms of proof, so to speak, one person would be able to take leave, to care for the other. How are you determined to be eligible for the different types of leave? If you've worked for a large employer, the federal FMLA still exists. And you have to, in order to be eligible for that, you have to have worked for your employer for at least 12 months and 1,250 hours in the time period right before you're seeking leave. Starting next year in Connecticut, there will be no hours worked requirement. So as today, Connecticut has 1,000 hours work requirement, and for family and medical leave, that will go away. And job protection, meaning the ability to get your job back, will attach after 3 months. So once you work for your employer for 3 months and you go out on FMLA, you are entitled to return to your job, same pay, same position. If your job no longer exists, then you're entitled to get an equivalent job with the same pay, same position, all of those things. For eligibility regarding paid leave benefits, there is amount of money that you have to have earned. You have to have earned at least $2,325 in the highest earning quarter of the first 4 of the 5 quarters immediately preceding the time that you're looking to take leave. You also have to be employed or currently employed and working in Connecticut. Let me say a little bit about that. So if you are working for a Connecticut employer, but you happen to be telecommuting or working from home in Massachusetts, but your employer is paying your unemployment insurance and your payroll tax to Connecticut, you're considered working in Connecticut. Also, you can qualify if you had been working and you were employed and working for 12 weeks right before you apply for leave. So let's say you were working and you leave your job or you're laid off from your job, and 3 weeks after that happens, you have a medical need and you have to take paid family medical leave. You can still do that and apply for leave benefits as long as you meet the other criteria. If you're a sole proprietor or a self-employed individual, you can certainly participate if you've opted into the plan. What do you get? Here's a summary of entitlements. If you are covered under federal FMLA, you get 12 weeks in a 12-month period, except for military caregiver leave, as I mentioned earlier, and you get 26 weeks in a 12-month period, but only 12 of those weeks are paid under our protection. So when Connecticut FMLA changes, you not only have your job protection, you get 12 weeks in a 12-month period, the 26 weeks if you're engaging in military caregiver leave, 12 of those are paid, 12 days for family violence, and if you're experiencing incapacitation during your pregnancy, you may be eligible for an additional 2 weeks. So all of the reasons that you can take job protected leave are the same reasons that you can take and apply for paid leave benefits. They're exactly the same. Oh, how does the Connecticut Paid Leave Act work? If you are a worker and or an employer, here's sort of a list of how things work. So with respect to contributions, workers are responsible for contributing 0.5% of their FICA wages up to the Social Security contribution limit to the Paid Leave Trust Fund. Employers are responsible for creating a paid leave account, deducting those wages, and remitting them to the paid leave authority with the appropriate documentation. At the authority, we are responsible for receiving and reconciling those contributions. We process any over or underpayments that individuals or companies may have made, and we do impose penalties for non-compliance. We've not done that in this first year because, quite honestly, everybody's been through enough. But starting next year, if we still have employers that have not been withholding the 0.5% and people are applying for benefits, we will be imposing penalties on employers. The Connecticut Department of Labor is the agency that is responsible for determining whether or not an employer can go back in a person's paycheck and take out more money to catch up if they haven't done the withholding since January. And that is based on their authority to manage wage and hours for each employer. Now, when it comes to paid leave claims, here are the responsibilities as they fall in those same categories. As an employee or a worker, it's your responsibility to submit your application in a timely fashion. You'll be able to do that in a number of ways, either by faxing, mailing, going online, or there's the AFLAC site, which because AFLAC is managing the claims administration piece. When you do that, you will have to create an account. And the reason we ask you to do that is because we know you will be submitting a lot of very personal and private protected information. So in order to have a higher level of security when you go online, you will be asked to create an account. And then after that, you'll be able to get into that account and be able to track the progress of your claim. You will have to update your account with absences and any other information about any other sources of money that you may be getting, because that might affect your benefit rate. And you have to let your employer know that you've applied and that you plan on taking leave, because we don't want people just disappearing and losing their jobs. Employers are responsible for what will be known as the employment verification. So in your welcome packet as an employee, you will get a form you'll have to give to your employer, and they will need to complete it and send it back to AFLAC. They will keep track of your absences. They will let you know what policies you need to follow when you go out on family and medical leave. And they are to refrain from discriminating or retaliating against you for taking either family and medical leave or applying for and accessing paid leave benefits. At the Paid Leave Authority, along with AFLAC, who is our partner, they help us to determine eligibility, and they basically do everything related to a claim from beginning to end, including making the payments, monitoring ongoing claims, assessing any request for reconsideration. So let's say your claim is denied because we didn't get all of your paperwork. Once you send it in, they can reconsider that. They are also responsible for engaging in investigations if we suspect fraud and imposing penalties along with our authority to do that. If there are issues regarding the decisions about claims and your claim is denied and you think that is wrong, there is an internal process that you can follow. And if that internal process still doesn't get you the result that you desired, you can go to the Department of Labor and file an appeal for your denial of claims and penalties if they're imposed on you at all. A little bit more detail about how this process works. So you can call AFLAC, you can go to ctpayleave.org. There will also be a fax number that you can send things to, and you can also mail it. So there's all kinds of ways you can submit your application. If you do it online, we will ask you, as I said before, to create an account for your security, and then you'll be able to click on Submit a Claim. And when you do that, you're going to get a checklist that tells you all the things that you will need to get before you start your application. So you can go grab those things before you get started. I know one of my pet peeves is I get in the middle of something and they ask me, for my passport number or something crazy. I'm like, how was I supposed to know I was supposed to have this in the middle of this? So we wanted to create a checklist so you can not have that level of frustration. AFLAC, after they get everything, will determine your eligibility. And if you are determined to not be eligible, let's say you didn't earn enough in that period, or you're not working in Connecticut, you don't meet one of the criteria, or you're taking leave for one of the reasons that aren't covered, you'll be denied that leave, but you can also ask for reconsideration. They also review the supporting documentation, including the employment verification, to let you know if anything's missing. And again, as I mentioned before, you can always ask for a reconsideration. And we are very actively engaged in that process. We are looking at those claims to make sure that they're making the decisions based on the criteria that we've given them. They calculate the benefits. So we'll go down what we call the happy path here at the Paid Leave Authority and assume that your application is approved. They then calculate your base weekly earnings, because that's how we figure out how much money everyone gets. And then they issue benefit payments. They are always issued on Tuesdays, and they're always issued 2 weeks in arrears. So for example, if you were eligible for benefits starting on January 2nd through January 8th, your benefits will actually be issued 2 weeks after that on January 18th. And that is to be sure that all of the I's are dotted and the T's are crossed, and that all there are no other issues to be resolved, and then the payment will be issued. But as a worker, you do have a responsibility for letting us know what's happening. If you have a change to your start or your end date of your leave, if you're earning more money, if you've gone back to work, let's say you have a couple of jobs and you've gone back to work at one of them, or if you're taking what's known as intermittent leave, which is leave just in blocks of smaller blocks of time, then you need to let us know that you're doing that. And you will have to report that more frequently, because that is a more complex leave to manage, and we want to make sure that we have our records and that they're accurate, so we don't deprive anybody of time that they're entitled to. How much do I get? We get this question a lot. If you make less than or equal to the minimum wage, then you get 95% of your base weekly earnings. So that's pretty simple. You will get $520 a week. If you make more than that, then you start out with the 95 times the 40, and you get it's a pretty convoluted formula. I'll show it on the next screen. But the most that you can get is 60 times whatever the prevailing minimum wage is right now, which is $13 an hour. So if you make more than a minimum wage, the most you can get is $780 a week. Here's a bit of an example. So worker A earns minimum wage, and they then get, they make $13 an hour. Their base weekly earnings are $520 a week. They get 95% of that, so they get $494 a week. Worker B earns above minimum wage. They earn $13.50, so their base weekly earnings are $540. What they get is still 95% of the base of the minimum wage, so you'll see that there. And then they get the difference between what they make and what the base weekly earnings are for the minimum wage, and that equals $12, so they get $506 a week. So it's a bit more than the person that earns minimum wage. All right, so what happens if your employer offers you additional benefits? So let's just walk through this chart a bit. So first of all, let's start on the left. Your employer and the coordination of their leave policies really depends on what their leave policies are. So your employer can require or permit employees to use their PTO to cover all or part of their leave, but starting next year, they cannot force anyone to exhaust all of their leave. They have to allow an employee to keep 2 weeks of their PTO. An employee may offer to use it all up, but an employer cannot compel you to do that. If you don't have any PTO to use, then you get your family and medical leave approved by your employer, and then you come to the Paid Leave Authority to get the full amount of your benefit for the entire time that you'll be out. Okay. If you have enough to cover the entire leave, most employers ask you to use that first. So if you use that first and that covers all of your leave, then there is no CTPL benefit that is available to the worker. And I hear it now, people are saying, why do I have to contribute to the fund and I'm not getting anything? Because often people move from one job to another. So although you may have PTO at one job, you may move to another and not have it. So your payment into the insurance trust fund will allow you to draw from it no matter where you work. If you have some time to cover part of your time, then the benefits start when your leave is exhausted. So let's, for example, say you have 4 weeks of paid time off, just a big bucket. You have to keep your rate. The employer cannot require you to use all 4. So you would use 2 for you to go out on leave, and then you'd come to the Paid Leave Authority for the remaining 2. So all of your time would be out, and that you're out would be covered, and you get your full pay, your regular pay from your PTO. And then you would come to the Paid Leave Authority and we would pay up to that $780 depending on how much you're making. If your employer has a short-term, long-term disability, some other kind of policy to help you make up the difference, that's where this next category comes in. So let's say that you have paid time off, but it pays less than your regular pay. Maybe the rate is lower or it only covers half of your days, all kinds of scenarios. You still get your paid leave benefit at the start of your leave, and we pay that benefit according to the law, the calculation I just showed you. And the employer can coordinate your benefits, whether that's short-term disability, long-term disability, whatever they may have, to make up any wage differences you might have between what you get from paid leave and what your regular pay would be. But employees under the law cannot get any more than 100% of their regular pay between what they get from the Paid Leave Authority and what they get from their employer. So a few tips: if you're trying to figure out what you're going to get from the Paid Leave Authority, you need to find out whether your employer will require or permit you to use your time off while you're out on leave. And obviously they have to let you hold on to your 2 weeks. If there are any rules about how that time is used, and if they offer a short-term disability policy, sometimes those policies require you to use all your employer PTO with the exception of the 2 weeks, or any state benefits before they will let you use the short-term disability policy. So you really should be asking about what those terms and conditions are, and also ask whether or not they will reduce any amount that you'll get from the Paid Leave Authority. So those are all kinds of questions that you should ask. And everyone who's attending this evening and who's registered will get a copy of these slides. So you'll have these to refer to again. A little bit about family and medical leave. Now, this is not the same thing as paid leave, as I mentioned before, but the law is changing and it does affect all workers in the state. So we want to mention that. We as a Paid Leave Authority are not responsible for administering family and medical leave. We only administer the paid leave benefit. But now that the family and medical leave law is changing too, and it will apply to employers with one or more employees in the state, it's important that you know about this. So you will be able to take time off, whether you get paid for it or not, for all of the reasons I mentioned earlier: pregnancy, military caregiver, family violence, and the like, your own serious health condition. But you have to let your employer know in a timely fashion. You have to submit your application and give them supporting documentation and comply with the attendance policies. Employers will be posting posters in their workplace about this. If you're working in a large enough workplace now, they may be up already, but if you're in a smaller workplace where family and medical leave was not a part of what was happening, this will be new for you. Again, because this is family and medical leave and not paid leave, we are not responsible for this. We just offer it so that you know that both of these things are available to you. And again, the Connecticut Department of Labor is the agency that oversees all of FMLA. They're responsible for making sure the regulations are in place, giving workers guidance, and investigating any complaints you might have about not getting access to leave or being discriminated against because you took it. All right, a bit about job protected leave. So I mentioned earlier that when you work 3 months, no specific number of hours, starting next year, you'll be able to access job protected leave for family and medical leave. And here's the way that you do that. You need to let the employer know that you're taking time off 30 days in advance if you know, as soon as practicable if you don't. Your employer will tell you whether or not in the first stage if you're eligible, meaning have you been there long enough, yes or no, for job protection. So if you've been there 2 months and 10 days, you're not eligible for job protected leave. If you've been there 5 years, more than eligible for job protected leave, as an example. So when you go to your employer and say, I need FMLA, you don't even have to use the terms FMLA. The employer then has 5 days to tell you whether or not you are eligible to apply and let you know of your rights and responsibilities. This is not the same thing as approving the leave. It's just basically saying, yes, we think you meet the criteria, but you have to bring us more proof. And the proof can include a medical certification from a medical professional, adoption documents, military records. You have 15 days to get these things to your employer. If you have trouble, they can give you another 15 days to do that. Once you get all of that documentation in, then the employer reviews it and they have 5 days to do that. If everything you've brought in shows that they should approve it, they will, but then they also have to tell you what all the rules are about how to use it. And if they will require you, if you're taking time to take care of yourself, if they require you to have a fitness for duty certificate before you can return to work. And these are things that you can talk about with your HR person or your benefits administrator. Now, the worker reports to the employer when they're taking leave, because we don't want anyone to exceed the 12 weeks because that can be problematic. If you're taking intermittent leave, let's say you're taking a family member to get dialysis or chemotherapy, that's covered under FMLA, but you're going to use it in shorter periods of time than you would if you were taking time off for yourself to recover from surgery. And you have to report that to the employer. Then when you come back, you get the same job that you got before you left. Same rights, same terms and conditions. An employer can't insist that you're 100% fit for duty or totally recovered. There may also be other laws that apply to create a reasonable accommodation to allow you to return to work. So remember, just to keep things in perspective for you, if you apply, you're approved for Connecticut or federal FMLA, you still have to follow the attendance policies. You have to let your supervisor know. You're responsible for giving them all the documentation. There might be other laws that apply to your situation. There also might be times when you don't want your leave to be designated as FMLA because you want to save your FMLA time. Your employer does not have that option. It is their right and their responsibility to designate all of the time that you take off as FMLA leave. And you're going to want them to do that, especially if there's some question about job protection. It's to your advantage to have that occur for you. I talked a little bit about some other leave laws that might apply. We won't go into any detail around these, but you should know that workers' comp, the American with Disabilities Act, the Pregnancy Disability Act, and what we call the Connecticut Fair Employment Practices Act, which applies to employers with 3 or more people, may require an employer to make what's known as a reasonable accommodation, meaning a few changes to their workplace to allow you to return to work. And those have to be reasonable. There's all kinds of rules around them. We could teach a whole webinar on that. But for tonight, I think it's just sufficient to list them here. Those laws that also offer income replacement while you're out on leave now include not only workers' compensation, but the Connecticut Paid Leave law. But you should know that you cannot be on workers' comp and receive paid leave benefits at the same time, nor can you receive unemployment compensation and paid leave at the same time. I've talked about a few things, and I did say it would take about 35 minutes, and it has. So there are some additional resources on our website, ctpaidleave.org. And you can find the employee rights poster, a smaller version of that, a fact sheet. If you go to the employee section of the site, all of this information is here. If you're with an employer who really doesn't have a good sense of any of this, there is an employer toolkit on the employer site that they can download as well and learn more about paid leave. There's also an HR toolkit, for anyone who's doing HR at your organization that you can direct them to as well. And we are here to help. We do not have a call center. I get that question quite frequently. It's because it really costs a lot of money, and we want to make sure that as much money as possible that comes in is available for benefits. So you can contact us through our website, and there's also a lot of questions and videos that are on the website as well. And so we thank you for joining us. And again, the website is ctpaidleave.org. All right, so I'm going to stop sharing my screen and turn my video back on. I only see one question. Okay, let's see. Oh, great question. Under the FMLA, is it required an employer to continue an employee's health benefit coverage? So, under the new law, as long as the employee is paying their share, then employers are, I don't know if they're required, but they're strongly encouraged to continue the health benefit coverage. But the employee, while they're out on leave, is still responsible for paying their employee portion of their health insurance. Otherwise, the employer does have the right to terminate the policy, and I have seen that happen from time to time, and so I would encourage you to work that out. And the same would be true for any other benefit that you're paying for, short-term, long-term disability, dental. You're still responsible for your portion of that premium while you're out on leave. Okay. All right. Yes, Brenda, we can help you. So drop your email in the chat. Amber will get you to someone. Are you there, Amber?
Yes, I'm here. I was muted
Okay.
while I was talking to you. Brenda, I'm going to reach out to you in the chat privately real quick so you can send me your email.
Yeah. All right. So let me see if there's some more questions that have popped up. All right. Where do we find the list of information when filling out an account? Not sure if I understand that question, but when you're applying and you will come across a checklist that will give you everything that you'll need, and you'll see it. It's actually just a part of the process. So you won't have to go searching for it. It'll pop up for you. Next question, if the employer does not require you to exhaust your PTO, are you entitled to the paid leave? Yes, you are. You are still entitled to it. So even if your employer does not require you to exhaust it, they can require you to use it first. So it's important for you to communicate with your employer as to what their policies are. But you're entitled to keep those 2 weeks, and you are indeed entitled to use your paid leave. Okay. Oh, I love paperwork questions. So should you use the FLA paperwork inserts? They are coming. They are coming. I promise you that the Department of Labor is almost finished with their forms, and we will have you using state-specific MedCert forms. So please be patient. They are on their way. I wouldn't use the federal FMLA, although they will be based on it. They are modeled after them pretty strongly. Okay. If you go on maternity leave and you still like the quality yes. So if you go out on maternity leave the beginning of December, you would still qualify for paid leave for the remainder of your leave starting in January. You would apply in December, and we would gather specific information about your case, and then your eligibility would be determined. But you also should know that bonding leave is available for up to 1 year after your child is up to the time your child is a year old. So even if you had your child in December, you would be able to apply for bonding for 12 weeks up through the following December, but don't wait too long because you're going to run out of the 12 weeks, literally 12 weeks of time that you can take. Will there be a place that employers can report suspected fraud? Yes, there will be a place where you can do that. You can do that on our website, and I think we will also have a fraud hotline with AFLAC. Yes. Okay. Let's see. Can you get paid leave if the employer allows you to keep more than 2 weeks of PTO? Yes, you can. It all depends on your employer's benefit, but you can certainly do that. It depends on how your employer administers their PTO policy. Some employers we're hearing from are saying, well, we're going to require people to use their paid time off to cover part of their FMLA, and then they can go to the paid leave authority for the difference. And one of the reasons that they're doing that is because there's a separate eligibility and access to time for CT paid leave and for FMLA. So they're trying to really just make sure that people aren't out for weeks or months at a time, which we understand. But it all depends on your employer's policy. And I think those are all of the questions that we had this evening. Trying to see if there's anything in the chat. Yes, Brenda, we will take care of you. It happens from time to time, but someone will always get back to you. I really want to thank everyone who took the time to apply. You can tell where my mind is. I want to thank everybody who took the time to come to this evening's webinar. And we'll be holding more of them. And we'll try to be moving to the Facebook Live platform so we can reach more people who will be interested in how it works. But we're glad that you're here. So thank you for your time and have a wonderful evening.
Thank you, Andrea. Have a great night.
Thanks.